There are several main types of ectopic pregnancies, each defined by where the embryo implants. The most common is the tubal ectopic pregnancy. This accounts for over 90% of cases. Here, the fertilized egg implants in the fallopian tube, which connects the ovaries to the uterus. Within tubal pregnancies, there are subtypes. The ampullary type is the most frequent, happening in the wider middle segment of the tube. The isthmic type occurs in the narrow portion near the uterus. The fimbrial type is found at the tube's fringed end near the ovary. There is also the interstitial or cornual ectopic pregnancy. This happens in the part of the tube within the uterine wall. It is harder to diagnose and riskier because it can cause severe bleeding. In all tubal types, there is a risk of tube rupture, which can lead to intense pain and internal bleeding. Ovarian ectopic pregnancies are very rare. Here, the egg implants on or in the ovary and can be mistaken for other conditions. Diagnosis uses specific criteria, and treatment often requires surgery, sometimes involving removal of part or all of the ovary. Cervical ectopic pregnancies are also rare. The embryo implants in the cervical canal, and this is often linked to prior procedures causing cervical scarring. Early diagnosis may allow for fertility-preserving treatments. In emergencies, more invasive surgery may be needed. Caesarean scar ectopic pregnancy occurs when the gestational sac implants in the scar tissue from a previous caesarean section. There are two types, depending on whether the SAC is closer to the uterine wall or the bladder. This type carries a high risk of heavy bleeding and may require medication or surgery. Abdominal ectopic pregnancy is very rare but high risk. The embryo implants in the abdominal cavity, sometimes on organs like the bowel, liver, or spleen. This type can lead to significant bleeding and always requires intervention. Heterotopic pregnancy means an ectopic pregnancy coexists with a normal pregnancy inside the uterus. It is rare, but more common with assisted reproductive technologies. If the ectopic pregnancy is treated early, the intrauterine pregnancy can often continue. Finally, a rudimentary horn pregnancy is extremely rare and occurs in a malformed uterus. There is a high risk of rupture in the first few months, and surgery is usually required. Understanding these types of ectopic pregnancies is crucial for early diagnosis and treatment, helping to protect health and fertility. Credits: script based on medical sources.